Okay, class, now we're on to respiratory alkalosis. So again, some of the examples, like a very good example are something like, okay, hyperventilation, panic, because they usually kind of go together sometimes, and then, you know, condition like pregnancy, okay, can cause respiratory alkalosis. But I think the easy example to talk about is something like hyperventilation. So I want you to again think about what is the physiological mechanism that actually what's happening in the body. As you're hyperventilating, you're breathing fast, so you're blowing off a lot of CO2, right? And so you can almost count on now, number one, looking at alkalosis, which means your pH is going to be high, higher than 7.5. And again, because you're actually blowing off CO2 on a respiratory problem, you can expect your CO2 to be low, greater than 35. So CO2, so again, because now the respiratory system is the problem, you can usually correct something like hyperventilation by either, you know, coaching them into slowing down, you know, giving them medication, deep, like, you know what, maybe slower deep breaths to try and slow them down, because technically having them, I've heard people say, have them breathe in a paper bag. You know, if you have somebody who actually has a CO2 retaining issue, that's actually going to hurt them more. So that's not really evidence-based anymore. But now you have to think about, okay, what is the kidneys going to do, or what is the person going to do? Is you'd have to like slow down their breathing, or the kidneys can actually do something like the kidneys can actually compensate by retaining acid or excreting base, okay? Because we're actually alkalotic, not acidotic. So you actually need to retain more acids. And so the bicarb system, if you retain acids, you would actually have to excrete base. And so your bicarb level will eventually go down. Okay, like, you know, at kidneys, and then again, depending on the problem, you know, it could be your lungs if you can actually, like in this case, slow the person down from actually hyperventilating. But the idea is that if you compensate, okay, by lowering the bicarb and trying to retain acid, then what happens is eventually you're going to change your hydrogen ions to bring the pH back down to try and buffer things out. And that concludes respiratory alkalosis. Thank you.